Depression, first of all, is more than normal mood swings. We all have good days and bad days, but when low moods set in and stay and persist and are there for most of the time, weeks at a time, even months at a time, that's probably when we have diagnosable depression.
Okay.
I think it's important to distinguish depression from a couple of other things. Depression is not a sign of weakness or laziness. It is, in fact, a medical illness, just like high blood pressure is a medical illness or diabetes is a medical illness. And it needs to be treated like those medical illnesses also need to be treated.
Now, I understand there are different types of depression.
There are. There are people who have a depression in response to a stressful event or a loss in their life, perhaps a loss of a loved one or a divorce. And many people are able to just sort of have a period of low mood or low spirits that lasts for a short period of time, and then they're able to bounce back and go on with their lives. On the other hand, for people who might be prone to develop depression, it can lead to a persistent set of symptoms that can interfere with their everyday functioning.
Dr. Bielski, before we get onto the topic of anxiety, I'd like to go on a little bit more on depression, signs and symptoms.
Sure. And it's important for people to be aware of the signs and symptoms, Linda, because in spite of the fact that depression is very treatable, only about 50% of people obtain adequate treatment for depression.
Why is that, do you think?
Well, I think part of it is they don't necessarily recognize it in themselves. That's why knowing the symptoms are important. But other reasons probably come into play as well. Some people are embarrassed to admit that they might be suffering from depression. And for other people, they might feel that, well, I'll just snap out of this someday. But well, once depression sets in, it's not likely that people can simply snap out of it without professional treatment.
Okay. Are there any set actual signs and symptoms that you see that we can talk about?
Sure. And they sort of are in a variety of categories and dimensions. The first set of symptoms maybe I'll describe are feelings that people have. It's common to experience feelings of sadness, emptiness, hopelessness, worthlessness. And interestingly, in depression, sometimes people actually blame themselves for having these kinds of feelings. Probably the hallmark of all types of depression is a decreased ability to enjoy things that previously had been very enjoyable for a person. And people suffering from depression often lose interest in things that they previously looked forward to and engaged in actively. It's not uncommon for people with depression to withdraw from participating in various activities and also to withdraw from even family and friends. Depression can change your thinking and your thought process. People with depression very often become very self-critical, begin to get down on themselves, and may experience very excessive guilt about things, real or imagined, that they have done or not done. Certain physical symptoms can also go along with depression. People often have trouble sleeping, sleep disturbance, either difficulty sleeping or insomnia, or actually some people experience excessive sleeping.
Sleeping too much.
Sleeping too much. Appetite can also be disturbed, with some people having decreased appetite, other people having increased appetite and weight gain. Physical symptoms like headaches, stomach aches, backaches are also common in depression. Irritability is also a common symptom and can lead to problems with friends and family when one is suffering from depression.
A lot of different things go on.
A lot of different things. People can be very tired, fatigued, and feel sluggish or very low in energy during a course of depression. Difficulties concentrating are one of the things that can interfere the most with functioning in depression, and it can affect people's work performance significantly, and even performance at home. Everything becomes more difficult to do in an episode of depression.
Well, do we know yet what causes depression? And I don't mean for those that have a short period of depression, such as someone who's lost a loved one, but those who have been struggling with this all of their lives. What actually causes it?
Well, there are probably a couple of different possible causes. As I mentioned earlier, some people can get depressed simply in response to stressful events. For other people, there are clearly hereditary or genetic factors involved, and people with predisposition to develop depression are also predisposed to actually have a set of complex biochemical changes go on in their brain. We actually see, and there's quite a bit of research evidence to support that there is a chemical imbalance that occurs between at least a couple of different chemical messengers in the brain, one of which is called serotonin and the other is called norepinephrine.
Okay, but these are all treatable?
These are all treatable, yes.
Okay. Do you see a difference or anything between men and women as far as men suffering more than women or vice versa?
Well, depression tends to occur about twice as often in women than men. We're not absolutely sure why that happens, but those are the statistics, and they've been consistent now for a number of years. There are two sort of peaks of incidence of depression and times at which they occur most often in life. There's a peak between the ages of 20 and 40.
Well, we're talking women here, right?
Men and women, actually.
Men and women. Okay,
yes.
so between the ages of 20 and 40,
Yes.
either male or female.
Correct.
Okay.
Slightly younger age of incidence for women, a little older for men.
Okay.
And then there's another peak beyond the age of 65 where depression becomes, again, more common.